Coming up on Paramedics Emergency Response.
A wad full of money in his hand. Oh, it is.
This dude has a fistful of dollars and is laid out.
Were you stabbed? Does it look like it?
The old trip and fall story? Come on, look at his wound.
You're feeling short of breath today?
Oh yeah, really.
He looks uncomfortable and his shortness of breath is evident.
Oh, this has been going on for about a week now.
You know how fast they say they were going? It seems that one vehicle ran a stop sign and T-boned the other car.
Oh wow, that's total, hey?
Starting to yawn.
Oh yeah, you know, I'm tired. Maybe this will wake us up.
This is 67. Calling for a 55-year-old male who took a fall outside of this location. He has a head injury and is not alert at this time.
A cabbie. Must have been getting a ride home from a cab. It says he, I don't know, fell in a truck or something that must be parked beside him.
Okay.
Lots of things can cause falls. It's dark out. Alcohol can also cause falls, but he's apparently hit his head and he's not alert at this time.
He's got a wad full of money in his hand. Oh, it is.
We pull up on scene and it's like a Clint Eastwood movie. This dude has a fistful of dollars and is laid out.
Hi.
He's losing money and stuff.
I see that.
He's losing out of his pocket, so I put it in his hand, but there's a lot of it.
Okay.
I fell down. I was trying to help him. Did pretty much a face plant into this truck.
Has he been drinking, do you know?
Yeah, he's been drinking a lot.
Hi. Can you hear me? We're the paramedics.
He hit his head on the side of the truck. It's quite possible that this patient hit his head on the vehicle and then on the pavement during his fall. Was he talking to you after that?
I couldn't understand a word he said.
I can't understand what his name is even.
I was helping him out of the cab, and he did a face plant on this truck.
Yeah, can we roll on your back, sir?
He's been laying there for 20 minutes or so.
I'm just gonna roll you so I can see you, sir.
So I can't move him because I weigh 155 and he's like 250 or whatever.
So just gonna check his glucose. Oh my goodness, it's 30.
30?
Yeah, 30.3. We checked the patient's blood sugar. It's extremely high. Do you take insulin, sir? This could be contributing to this patient's lack of awareness. Do you have pain in your neck here, sir, where I'm pushing? No? No. Pain in your shoulders? No, pass me this arm. I'm just gonna hold your money here.
There's another 50.
Oh my goodness.
Under there.
I want to stick it someplace safe. Holy, there's like thousands of dollars there.
We're going the distance to collect his money for him. Otherwise, he would have lost a lot of cash tonight.
You
Ready?
gonna throw up?
2, 3.
Grab that stretcher. This patient doesn't appear to have a head injury,
That's it.
but he'll be transported to hospital for further evaluation.
1967, C-test 2. Yeah, this man, it sounds like he was out drinking at the bar tonight. He was heavily intoxicated according to the taxi driver, and he just fell. So we're just gonna take him to the hospital for further evaluation.
That salsa is garlicky.
It is.
Yeah, like, I need gum.
I think I can smell you from here, man.
You're just saying that. I know what you're doing.
Hi, sir.
I know what you're doing, and I don't like it.
This was called into us by city police. We have reported of an unknown age male who has been stabbed. They were en route at time of call, not yet on scene.
So do you need a stage for this, you know, like?
Police haven't secured the scene, so there's a good chance we're going to be staging. 1967 base, should we be staging for this?
So my thoughts are it's another stabbing. I mean, we get a ton of these calls and, you know, is it legit? Is it not?
City police are on scene and it is safe to proceed.
We don't know until we get on scene.
67 copies.
107 copies.
As we roll up on scene, I see police and fire, but we still don't have an update on the patient's injuries.
Cops right here. The scene is secure.
10 copies, attention.
Standing up.
The patient is standing up, talking, appears stable at this point.
I don't know, I just tripped, I guess. Tripped on the cement.
Typically, if a patient's assaulted and they're able to talk about it, they usually don't want to talk about it.
Were you stabbed?
I don't know. Does it look like it?
The old trip and fall story? Come on. Look at his wound. It doesn't match up. Were you stabbed anywhere else?
No.
Just your hand?
The cops already looked. I'm good.
So this patient has an injury to his hand, but we still need to do a head-to-toe assessment to make sure we don't miss anything.
Let's check your back. So I can tell this patient has a laceration to his hand, but my main concern is, are there any life-threatening injuries? Check the armpits.
I just want the ambulance, not the whole crew.
Yeah, while we're here, man, we're checking you out. You get you bandaged up, okay?
How about you come to the back of the ambulance? Once we get the patient in the back of the ambulance, it's a lot easier to do a more thorough assessment.
Yeah, no worries. Here, let's get you up on the bench right now. On the bench. So the cops got to do their job, ask their questions. Did you get any more to the story from what he said?
Can you just walk me through what happened?
And I got to do my job, just treat the patient.
So who's the guy who attacked you then? He told me like, yo, what's up? And I started like, I took him down, started like pounding on him, then all of a sudden he flipped me over. Started pounding on me, then slapping.
Okay, we're good, man. So at this point, we have all the info we need. We're gonna take the patient up to the hospital to be seen by a doctor.
There's your gloves, here's your tubes.
Thank you.
Case to 67. You're responding for a 67-year-old male patient complaining of shortness of breath, history of asthma. Patient has used prescribed inhaler with no relief.
Remember when I said I hadn't given a neb in like months?
Yeah, no kidding.
We're responding for a 67-year-old patient with an asthma history. He's used his prescribed inhalers with no relief,
It shows that we've been here a few times.
and that tells me there's potential for this to be a really serious call.
As we approach this patient's bedroom, he meets us at the door. Why don't you have a seat on the bed here or in the chair? Would you prefer the chair? He looks uncomfortable and his shortness of breath is evident. You're feeling short of breath today?
Oh yeah, really.
What time did it start?
Oh, this has been going on for about a week now.
You have asthma, I'm told.
Oh yeah, I've got asthma.
What a
COPD.
COPD. You're a smoker?
Oh yeah.
How much do you smoke?
About half a pack, maybe a day now.
Half a pack.
Yeah.
Any chest pain today?
A little bit.
Oh yeah, he's expiratory wheezing on the uppers.
This patient tells us he has a history of COPD. It's very smoky outside, and he's still smoking half a pack a day. These could all be contributing factors as to why he's short of breath right now.
Do you feel like you have a fever?
10-4-19,
I feel warm, yeah.
Feeling, yeah, this is showing that you're a little bit warm.
What's his temperature?
Trying to get the chills.
37.7, 37.8. We're gonna take a picture of your heart. We're also gonna get some oxygen on you. Here, the first thing we're gonna do is get this mask on you.
His lungs are very tight,
I can hear you wheezing even without my stethoscope, sir.
and giving him this nebulizer will help open his lungs up.
You've never had a pneumonia, have you?
Oh yeah.
You have.
Yeah, 2 years ago.
This patient said he had chest pain. We don't think that's his underlying cause, but we're gonna do an ECG just to make sure.
This will fix that right up.
Okay, so we're gonna take this picture of your heart. I want you to sit nice and still. Almost done. It's 0.136, it's a bundle.
This patient's ECG is normal.
I'm gonna take a listen to your lungs again here real quick. Then maybe we'll work on getting you out of here.
98.
Well, he's still wheezy, but he's not as wheezy. He's a little bit better.
The patient responds well to the neb. His oxygen has improved, and now we can transport.
Now you come with me, sir. And do we have your health card?
This patient's feeling feverish and has been unwell for 1 week. He has a history of pneumonia, which means there could be an underlying chest infection.
What do you think, Kelly? 2 or 3?
We're gonna transport this patient to hospital. He'll receive a chest x-ray and some blood work to determine the cause of his shortness of breath.
I thought it was gonna be okay.
Rob's a supervisor who works really hard for his team.
I know. It hit too close to home.
He is one of the most caring individuals.
Some time to pull yourself back together?
No, it should be okay.
So as a supervisor in dealing with our crew's mental health, he's always there, able to provide the support they need and or a voice.
Never lose that human touch, but that's why you're going to be good at what you do, because you care,
he'll talk to you. And that's one of Rob's best attributes,
If you didn't care,
Yeah.
he wouldn't hit you.
because he really does care.
Get over there. Come on. You good, right?
Throwing the needle here.
Case to 23, you're responding Delta to a multi-vehicle NBC on Highway 16 East. Possibility of 5 patients. No reports of chemicals or entrapment.
We don't really have an idea of severity of injuries right now, but we do know that nobody's trapped, so that's a good thing.
This is a bad intersection.
I've done a code 5 out here before. Code 5 means that someone is dead on scene, and I have done code 5s at this intersection before.
There we go. There's a unit going over there. There's a hose here. Watch out. Where are you going? Over here, man.
I'm gonna go to this.
Why?
Well, where's the people?
Well, I don't know.
Dane's trying to give me a hard time about my driving. He may be higher trained, but I'm the more senior medic on car.
Sorry. He's driving.
I see multiple RCMP officers, first responders are there, as well as another ambulance.
You got patients over there or just over here?
Right there, the guy, his arm, and then there's another female passenger that was being checked out, I think, in the back of the rescue truck. So.
Oh, okay.
Okay?
All right.
Thanks. After getting the story on scene, it seems that one vehicle ran a stop sign and T-boned the other car.
Oh, wow. That's total, eh?
Arrived on scene, we had 5 patients. We immediately did a triage situation of the 5 patients and continued to follow through with our medical assessment.
I missed all that. What's happening?
We got 5 patients.
Okay.
Over there, this one has an arm injury.
Okay.
And there was another lady who rescued it over here.
So these guys were the ones coming down the highway.
Okay.
And the older gentleman here driving that car just kind of came shooting across and they T-boned him.
I'll go over there then and just talk with them.
All 3 in here say they have no injuries, shaken up.
You guys are all good, hey?
I got hit in the face with the airbag and some glass, but I'm fine.
We were coming down north, coming north, and the car looked like it was stopping, and all of a sudden it just didn't. It come flying through and hit us.
You okay, pal?
Anytime your body is exposed to an event of stress or injury,
What's wrong?
My stomach really hurts.
Your stomach hurts now.
you go into a state of fight or flight. It's a survival instinct that causes a massive release of adrenaline inside your body.
I don't know. I mean, it's tough to tell.
It makes you not feel injuries. It makes you more aware of your surroundings. And so when that adrenaline wears off,
whereabouts is the pain in your stomach?
You start to feel aches and pains that you didn't feel when you were in the height of the moment.
Do you remember everything that happened? You never lost consciousness, eh?
I never lost consciousness. I just didn't see it. All of a sudden, bang, and then hollered.
Yeah, I'm gonna jump in first.
Well, I think we should probably take the proper precautions, put you in a collar, and take you to the hospital, okay, and get you checked out. So we need to take spinal precautions, and we put this guy in a seat collar.
Everything from seatbelts to airbags to crumple zones worked in these people's favor, and they're all able to walk away with very minor injuries from what could have been a very catastrophic accident.
1967, this is a Bravo response for a 23-year-old male who has been assaulted with a head injury.
Or assault with head injury?
Yeah.
Any weapons or anything?
It doesn't. The assailant's gone. The assailant wasn't armed.
We're responding for a patient who was assaulted with a head injury. That's not a lot of information. It could be as simple as a laceration to a brain bleed.
Chances are they've been drinking. They're at a bar. Bar fights at this hour in the morning aren't all that uncommon. It's funny how the city just blows up like that, eh?
Mm-hmm.
A lot of times we'll see patients that have been knocked out and have a head injury, or maybe have a chest or back injury if they've been stabbed. You really just don't know until you get there. It doesn't even look that busy here. There's 4 cars out front. 4 people can't get along. They're all fighting and beating each other up.
When we pull up on scene, the patient emerges from a nearby parked car.
His shirt is spotted with blood, but he's conscious and walking towards us. Just keep your neck nice and still. I just want to see if that's a cut or if that's... I want to palpate your neck. I want to make sure you don't have any pain down your neck or your back, okay? So I'm going to start at the top and work my way down. I'll go nice and soft, just so you know, like, kind of pain in here.
Can we get a collar? This patient's complaining of pain to his neck and back. We're gonna put a collar on him just to be safe. Sorry. Discomfort there too, hey? We're gonna put a collar on your neck because you got some pain there, okay? Just like a plastic collar to help you turn on, you don't have to move it. It's best if you come to the hospital with us and get an x-ray.
Really?
Well, if you got neck pain, I think you should keep your neck nice and still. Try not to move it. Did you lose consciousness? Get knocked out?
I don't think so.
No?
Well,
keep your head nice and still.
I don't know.
This patient appears confused, has poor recollection of the events. It is possible that he has a concussion or any other form of brain injury. So I'm just gonna hold your neck, okay? Just until we get that collar on.
Oh, my ears hurt.
Nice deep breath.
I was over here in my van and my brother was coming out of the bar. They were parked in a car in between me and my brother and they thought my brother was yelling at them.
What happened here tonight? I think it was a bar fight of some sort.
The guys kept yelling and coming towards us.
I'm not that kind of guy, no.
He grabbed at my brother, punched him in the face, and then threw him on the ground.
So this is that collar I was talking about.
Jumped in the car because I said I was calling cops.
You know what, man? It's best for you. Trust me.
Can you take it off?
Like, this is it. Like, yeah, this is it. This is what happens.
I mean, it's up to you, but it's absolutely best for you. Why don't you just come to the back of the ambulance? We'll jump in there. Yeah, that's okay with you? We'll check your vitals and we'll... Here.
No, I'm not laying down on that.
You know, well, if it's way better for you to lay down.
Serious?
Yeah, man, like, why not? It's way better. If you have a neck injury, sitting up isn't gonna do you any good. It takes a little convincing, but this patient finally agrees to come to the hospital. Just relax your head back into the stretcher.
Even though our patient was very reluctant at first, I'm glad he decided to go to the hospital. Who knows what kind of brain injury he might have sustained. We don't know many details, how many times he was hit. He thinks he was knocked out. He chose wisely.
We're the paramedics. Can we roll you onto your back?
He hit his head on the side of the truck. On the call with the gentleman who fell with the cash in his hand.
There's another 50.
Oh my goodness.
There.
I want to stick it someplace safe. The night of the call, he remembers going to blow off some steam because he recently lost a loved one. The patient says he remembers leaving the bar and then all of a sudden he was on the ground and people were kicking him. The next thing he remembers is being in the hospital.
Were you stabbed?
No, I just tripped, I guess. Tripped on the cement.
The male with the wound to the hand.
Yeah, while we're here, man, we're checking you out. Get you bandaged up, okay?
The patient went to the hospital and needed stitches on his hand. He is doing much better now and healing well.
You're feeling short of breath today?
Oh yeah, really.
What time did it start?
This has been going on for about a week now.
Regarding the patient from earlier in the night with the shortness of breath.
Here, the first thing we're gonna do is get this mask on you. I can hear you wheezing even without my stethoscope, sir.
The patient was hospitalized for 7 days to recover from his illness. He is now recovering from back surgery he had a couple months ago, but is doing well.
Was he the driver of this car?
This is Ken.
Hi, Ken.
Hi.
The older gentleman from earlier in the night that was T-boned at highway speeds. Do you remember everything that happened? You never lost consciousness, eh?
Never lost consciousness. I just didn't see it.
The patient went to the hospital that night for treatment of his injuries he received from the airbag. Both he and his wife suffered aches and pains for the months following the accident, but are now in physiotherapy and getting much better.
So I'm just gonna hold your neck, okay? Just until we get that collar on.
Oh, my ears hurt.
Nice deep breath. Regarding the call with the young man in the bar fight, you know what, man? It's best for you. Trust me.
Can you take it off?
I mean, it's up to you, but it's absolutely best for you. He was transported to hospital. He was treated for minor injuries and later released.